right, welcome back. Tuesday tactic number 4, and heartburn. So what? What's the big deal? We all get heartburn from time to time. It's not that big a deal. Just pop some antacids, take some Pepcid or Prilosec or the purple pill or whatever you have on hand, and you can take that for as long as you want. Everybody's doing it, right? Well, not really. And here's the issue. 50% of us in the United States use antacids. It's the third most common over-the-counter medication. This shocked me when I did some research. The average is 2 to 6 doses per day. That's a lot of medication. And the average person is taking these things for 20 years. That is a long time and a big expense for medication. Acid has purpose. I mean, it sterilizes our food. It helps us absorb nutrients. It helps break down protein, and it prepares food for further digestion down the GI tract. And so what happens when we age? The acid production decreases, just like our hormones, our testosterone, everything else. And people that are over 60, their acid levels can be as much as 50% decreased from when they were younger. This turns out to be a big deal. There are some signs that you can look out for low acid, and that's nauseous after taking some supplements, itching around the rectum, feeling bloated, belching and gas. A lot of people think that's too much acid, but it can also be signs of low acid. Burning after eating, cracked and peeling nails, and muscle cramps. Those are all signs of having low acid. And there are some diseases related to having low acid as well. Asthma, celiac disease, diabetes, eczema, gallbladder problems. The list is pretty extensive. And so the important thing to know is what is causing the symptoms, not to mask them with antacids or other acid reducers over the counter. Classes that we typically use are H2 blockers or proton pump inhibitors. And so I'm not going to get all pharmacologic with you here, but like anything, long-term use of medication has consequences. And this is critical. You must know this, and that's why I'm sharing it. People who take proton pump inhibitors, I'm going to pick on this type of medication. It's like the Protonix and things like that. They decrease absorption of a lot of vitamins. This can lead to micronutrient deficiency, lack of energy, fatigue, mental fog. Particularly, it affects B vitamin, B12, vitamin C, calcium, iron, and magnesium. And so just take that into heart for a moment. What happens with calcium? Calcium is important for bone health. It's also important for brain and muscle health. And so if that's depleted, what's the result? Thin bones, poor performance, increased risk of fractures. Huge problem. People who take these acid reducers for long periods of time have higher risk of breaking a bone. Nobody wants a broken hip or a spine fracture. What about magnesium? I talked about this in a previous podcast, in the Project U podcast, but for the purpose of the Tuesday tip, magnesium is deficient in a lot of our diets, and it's involved in hundreds of processes throughout the body. And supplementing magnesium is a pretty simple thing to do. But know that taking an acid reducer causes magnesium deficiency. And so we're already low. We throw some drug on top of it, and that further pushes down the magnesium level. And we feel crappy. We perform poorly. Our muscles are sore. And we wonder why. We attribute it to poor sleep or some other factor. And oftentimes it is what we're doing to ourselves. So I think a better approach is to really explore what causes the acid problem. Is it a diet? Is it a lifestyle? You're eating too late? You're drinking too much coffee or alcohol? Is there some stress issue that's not been addressed? Or if you're older, is your acid level just reduced, plain old reduced? Know this, that untreated acid reflux can result in changes in the esophagus, the food tube. The big deal about that is it can lead to cancer. Esophageal cancer is horrendous. It's a huge surgery. It's going to cause a radical alteration of lifestyle, and obviously not something that's desirable. So I would suggest if you have chronic acid problems, you should talk to your doctor about having a scope done. Just a quick look down the throat into the stomach while you're asleep. It's not a big deal. I've had it done before. It's quick, painless, and oh so important. The other thing is to be tested for a bacteria in the stomach called H. pylori. It's called H. pylori. And this is well known to cause stomach ulcers and be implicated in acid reflux. And I'm surprised when I talk to patients how many people have been taking acid reducers for years and even seen several physicians and have never had this checked. If it's present, it's very simple to eradicate and treat. And then the last thing I'm going to throw out there is something called betaine. It is a sort of a way to replace acid. I would recommend certainly talking to your doctor or a functional medicine physician or a naturopath before you start taking it. But that sort of kind of sums this up. So what I want you to get from this is that, yes, having heartburn and acid problems is common. Is it normal? No. Just because it's common doesn't mean it's normal. And that I want you to be cautious about taking over-the-counter medication for years without doing some further exploration and making sure that nothing else is lurking on the surface that is bad and could kill you. So that wraps up this Tuesday tactic. As always, if you want more, head over to the blog at mitchellmd.com. And this is a part of the men's health course of a separate discussion, a little bit more in depth about GI issues. You can join that at mitchellmd.com/men to get some more information. And as always, join me on Tuesdays between 12 and 12:30 Central Time, where I share the Tuesday tactic on Periscope. It's a little different audio format of this. It's just me, camera, and usually somewhere outdoor filming in nature. So hope you enjoyed this. Would love it if you could leave a review on iTunes. Helps this get found. And please share it if you find a family friend or someone that would benefit from this information. I'd be so grateful if you shared it. As always, have a fantastic week, and I'll be talking to you soon.